Studies show the time it takes to diagnose and initially treat lung cancer is about 90 days, particularly for surgery. But what if you can cut that time down to 1 day? Circle of Health reporter Denise Dodor shows a multidisciplinary approach that's reducing recovery, worry, and cost.
Breathing comes easy now for 83-year-old Kathy Indovina, but several months ago, it was a different story.
I had been coughing up blood. I wasn't looking at that as a symptom of anything in particular. I had no idea what was causing it.
The cause was a suspicious lesion in one of her lungs, but when doctors told her she would need a surgical procedure to biopsy it, and then months later, possibly another surgery to remove it, she refused.
And I said, can't we possibly do those together? Because I don't want 2 different appointments if I can make it in one.
That's not how it's usually done. From diagnosis to treatment, most patients will have to wait about 3 months. During this time, there's a lot of anxiety.
The patient's worrying about what that diagnosis is, what are the next steps, they're waiting for information.
At Providence Mission Hospital, patients with suspected lung cancer who are eligible can undergo what's called a single anesthesia, biopsy, and lobectomy.
It's less invasive when we are able to do everything at the same time.
Pulmonologist Dr. Robert Goldberg says the latest technology makes this possible. He employs a robotic-assisted bronchoscopy to biopsy the lesion. Once it's verified to be cancer, surgeons use minimally invasive robotic equipment to remove the diseased portion.
It takes a lot of logistics in order for it to be successful.
The entire procedure takes about 2.5 to 3 hours. And another big benefit is how you don't have to undergo anesthesia twice.
You have the risk of heart issues, lung issues, many different issues. So it's better to minimize that risk of anesthesia if you don't need it.
Dr. Goldberg says the procedure is covered by insurance. Patients go home within 1 to 3 days and are back to normal activities within a few weeks. Kathleen is glad she was the right patient at the right time.
The doctors and the nurses, boy, they were right on target all the way through the whole thing. They couldn't have been better.
Her prognosis is 90% 5-year survival.
In Mission Viejo, Denise Dodor, ABC 7.